I'm Elsa Foster. I'm one of the obstetricians and maternal fetal medicine specialists who works at John Hunter. Due to the current COVID pandemic, we've had to redesign antenatal care in order to maintain safe, essential maternity care for women in our community. The purpose of this message is to try and communicate to any GPs who refer to our service exactly what the key changes are. The first major change is that we are now offering a single entry point to maternity care at John Hunter through a universal first trimester screening service, which is available to all women planning care or birth at John Hunter. GPs can now provide a dual referral on a once-off occasion to a single number, which will allow us to provide care for first trimester screening as well as ongoing antenatal care. The referral processes for both standard referrals and e-referrals are now available on Health Pathways. Most women referred to our service will be allocated an appointment between 11 and 14 weeks, which allows us to provide a comprehensive assessment and pregnancy plan, as well as perform routine first trimester screening for chromosomal disorders or preeclampsia. If women are referred later than 14 weeks, we will still offer them a visit through that service to allow us to provide a pregnancy plan. At the conclusion of that visit, GPs and women will be provided with the results of that assessment, and ongoing maternity follow-up will be arranged. The next key change is that we've had to reduce the number of routine scheduled antenatal visits for all women. To allow us to do that safely, women will now be allocated into one of three models of care. Women allocated to high risk or maternal fetal medicine care will continue to have their visits through hospital visits at the John Hunter Hospital. Women who are allocated to low risk care can now have care with existing GP shared care pathways or through midwifery-led clinics, which will be now set up in community healthcare settings. The new visit schedule, as well as the expected care provided at each of those visits, is also now available on Health Pathways, but we're not anticipating that to lead to any major disruptions to the existing GP shared care pathways. The final change related to the pandemic is that we've had to change how women requiring urgent assessment at the hospital are referred and seen within our service. This continues to evolve together with the pandemic situation, but general guidance and key information and key phone numbers are available now on Health Pathways. In general, the referral processes will depend on the woman's clinical status, on the gestation of the pregnancy, and the COVID status of the woman. We are hopeful that these changes will allow us to continue to provide safe maternity care in this situation, but we'd be very grateful for GPs to provide feedback through the Health Pathways feedback forms.